we and others have paid significant attention to identifying high-risk smoldering myeloma. This is where we know these patients can turn into myeloma, and how can we prevent the conversion to myeloma. In this study, we focused on something a little bit different. What we were looking for are those smoldering myeloma patients who have a very low risk of ever becoming myeloma. And this is very important because these are the group of patients, almost 1/4 to 1/3, who have no chance of developing myeloma. They need to be reassured that this is not going to be of any trouble. They don't need to be seeing doctors so frequently, and they can get peace of mind knowing they belong to this group of patients. So in this study, Dr. Anil Samur, one of my colleagues in the lab, presented data where 45 patients, 81 samples were evaluated, where one group of smoldering or MGUS patient had progressed to myeloma, and we had sampled from both. In the other group, what we call non-progressor myeloma, where these patients had not progressed to myeloma for 5 years or more. So we perform whole genome sequencing, and we perform whole transcriptome sequencing. And what we identified is something that is very important, that patients who do not progress to myeloma, those who are good risk myeloma, they have a low mutational burden, right? Less number of mutations. The mutation burden numbers might change in general, but in our study, the number of mutations that were identified were less than around 6,500 mutations. The second point this study identified is that these patients have absence of chromosome 8 related copy number change, which does not involve MYC region, and they have a very few deletions. And this constitutes low mutations, absence of chromosome 8 copy number changes, and low deletion counts are the good risk myeloma patients. They show lesser complexity of their tumor, genomically speaking, and they do not progress very frequently. They remain in a smoldering state or MGUS-like state for a long period of time. Now, we also identified that genomic markers which identifies low-risk precursor disease, those same features are not important if we look at in myeloma patients. So if myeloma patients have those features, that doesn't tell us much about likelihood of progression and survival of the patient. So this is important in the early stage of the disease. In the transcriptomic analysis, the low-risk smoldering myeloma patient also show low expression of the MYC target gene. So MYC again comes out to be an important target, and also has a low DNA repair pathway genes. And our focus has been that if the DNA repair is perturbed, that's bad smoldering myeloma, that's a bad even symptomatic myeloma. So when it's low, that constitutes a good group. So our conclusion was that combining our low-risk model that I just described with the current high-risk model will provide opportunities for trials to be focused on the right patient population, providing some assurance and comfort to the low-risk patients that their outlook is outstanding, and that's very good. So I think this is the first description of what could be a good risk smoldering myeloma. So basically, we need to now get a larger data set, what we would call a validation data set. That this is our finding. Now, if we take 100 smoldering patients and identify those patients who match these characteristics, do they have a course which has been indolent, that they have not progressed? So validation of this in this group will be very important. And if once that is done, this can become standard for our clinical practice.